So a huge advantage of the OMIDRIA is, in my opinion, reduced complications. The pupils dilate reliably. We don't have the issues with floppy iris that we were having on almost every case, especially in a population of men who most all take some sort of medicine for their prostates. And there just rarely are surprises. It would just be nice to not have to worry about the unexpected as well as the cases that you expect to have IFIS. So we notice that we have much greater efficiency, much quicker turnover. It's much easier on the nurses to have a standard practice that's really straightforward. And so I do feel like having fewer complications, being able to do more cases, all of those things lead to an increase in reimbursement and cost savings. As a cornea specialist, I tend to get referrals from the retina docs and other docs of the difficult cases, very dense nucleuses, patients that have zonular weakness and other issues. And so I find that when we have OMIDRIA on board, I feel like we have much less inflammation than what we expect clinically in my hands. I find that I go in thinking, oh, I'll have to put in something else, maybe use a lot more steroids, and even work with the retina docs to give some sort of injected medicine, a week out, days out. And I tend to be surprised, more and more surprised that with the OMIDRIA on board is the only explanation that non-steroidal inside the eye. We've been pleasantly surprised clinically that many times these cases, they don't have the edema, the inflammation that we would have expected prior to using OMIDRIA. I teach residents of all skill levels, first years, second years, third years. And I will say anecdotally that it seems we have far fewer complications using OMIDRIA. And I think that is a huge testimony to the efficacy of the OMIDRIA. And on top of that, it's nice not having to stretch pupils. I feel like we have far fewer issues that lead to vitreous loss, because again, what is the most expensive thing? Breaking, or rupturing capsule, losing vitreous, having to open a vitrectomy handpiece. So I'm very thankful to OMIDRIA for that, because it just takes so much stress off the residents, and hence it takes the stress off of me.